Well, the pressure on healthcare in Gauteng is also being felt in the private sector. Let's find out what the situation is for the private hospitals. Always a pleasure. Life Healthcare Chief Executive Group, Peter Wharton-Hood, joining us this morning. Peter, good morning to you. Tell me why there's a stress on the private sector. Obviously, we know everyone is being overworked, but you're taking on a major load from the public hospitals to try and help. But talk to me about the pressures your group is feeling.
Hi, good morning. Yeah, we got 1,450 COVID admissions as of last night, of which 850 of those are in our Gauteng hospital, so roughly 60%. To put that in perspective, that is more than we had in either wave 1 or wave 2 in Gauteng. Wave 1 was just over 600, and in wave 2 just over 700 cases. And now we're already sitting at 850, with the forecast being that we've still got another 2 weeks of this surge before it reaches its peak in the province. So clearly we are under pressure.
Do you think you'll be able to cope?
We are coping. I think that we've learned from both waves 1 and 2, and we constantly try and make the best possible solutions occur at the hospital level. We've had to accommodate patients in our accident and emergency units if there aren't beds in the wards. We've even had to accommodate patients in some of our theatres to give them access to oxygen. So we do make every effort possible, and we have taken the learnings from the first 2 waves and applied them at the hospital level as and when appropriate.
Peter, I'm sure you're well aware of the reports that around Gauteng and around the Western Cape as well, that there were medical centres established last year. I recall Nasrec being one of them, another one in Coltonville. For someone who works in the sector, works in the industry, if those were up and running, do you think that would have been able to assist, A, the public hospitals, and B, private hospitals with more beds? Do you think that's where this has gone wrong?
No, I think prevention is far better than cure. I think that the learnings in wave 3 for us is this is a direct result of social behaviour and people not taking the necessary guidelines and following the obvious advice that's been given to them for months. Social distancing, masking, responsible behaviour is the best way to prevent this outcome. So to my mind, that would be like shutting the door after the horse has bolted. Let's rather get the right social disciplines in place to prevent this from happening. Of course, the field hospitals will provide beds and comfortable places for people to start the recuperation process, but it'd be far better for us to have prevented this in the first place.
So with 2 weeks left there or thereabouts with this third wave, the peak of this third wave, Peter, would you, as someone who is the head and sits on a very high level at the hospital, would you recommend a harder lockdown in Gauteng? Do you think that'll assist your hospital group and try and bring those numbers down by avoiding exactly the social issues that you're talking about? Harder lockdown, yes or no?
No, I think with 2 weeks to run, the infections are already in the system. A hard lockdown now is not going to prevent the peak for 2 weeks from now. What I would advocate, and the social consequences of a hard lockdown and the economic consequences are grave for those people who then are not able to work. Let's rather turn this into a responsible set of behaviour patterns where we listen to instructions. Masking, social distancing, that's in effect what lockdown really is. But we can do that without having to stop people going to work. I am sitting in the office today, I've got my colleagues in the office, but we've got a very stringent set of rules that we apply. And hopefully that makes the place safe, as opposed to leaving people at home. So I'm an advocate for making sure that the stringencies around enforcing the responsible behaviour. Of course, we've also got to accelerate the vaccination rollout. We've proved that we have so few of our healthcare workers sick in this wave 3 compared to waves 1 and 2. That I'm a strong advocate for vaccination, but we are also experiencing a slowness, if I can call it that, in getting people vaccinated. We don't vaccinate people on weekends, and some of our facilities don't have people to vaccinate as of today. So I think it's behaviour, and accelerated vaccination rollout is a better approach, and we need to do it fast.
Let's talk about that vaccination quickly, Peter, before I say goodbye. I was going to ask you about your hospital group and vaccination. Someone watching at the moment, they perhaps have a Life hospital down the road. My hospital for your group would be Life Olivedale, for example. How easy is it for people over the age of 60 to walk in? What's the process, very quickly? Do you need a doctor's letter? Do you need to register? Are you doing walk-ins? Just before I say goodbye, what's it looking like for the Life group?
Well, at this particular point, we don't have enough people to vaccinate. So what we are really asking for is please drop the age limit and let's get more people into the system. We've got more vaccinations arriving in the country, or vaccine doses arriving in the country. We need more people to vaccinate. And clearly we have to drop the age limit. We've got to get more people vaccinated fast. Time is our enemy. Let's get cracking.
And in your hospital, what does that process look like? If someone's watching now, they know a Life hospital down the road from them, Peter, what does that process look like at the physical building?
If they are over the age of 60 and they're on medical aid, they can walk in to our facility and get vaccinated. That's as simple as the process is. If they're over the age of 80 and uninsured, not on medical aid, they can also come to our facility and get vaccinated. But that's the stringency of the rules. So it's those two cutoffs that are critical. If we drop the age limit, we'd be able to get more people vaccinated and potentially ask for that people with comorbidities are also able to get vaccinated. That's what we're really looking for.